I think in yoga therapy in general, there's a confusion about what we're doing, which is kind of interesting. So are we mitigating symptoms, or are we finding ways for people's systems to reconfigure in a more permanent way? I think the default is usually mitigating symptoms. So like with anxiety, for instance, there's lots of practices in the yoga therapy world, right, to sort of real-time mitigate anxiety. It's sort of where you tell someone to breathe deeply, right? Like, and those practices are really good, but as a yoga therapist, usually when you're working with somebody, you want to, over time, teach them how to do practices that keep them out of anxiety, and then eventually over time, teach them practices that actually change what I see more as like the structure of their pranic body and their brain, so that they're not having the same reactive tendencies. So it's important when you're looking at working with people, it's important to look at, you know, you might get a client and they're sort of in a more acute state, and you might give them practices to sort of help them calm down. But eventually you want to work with their doshic imbalances so much, right, that those doshic imbalances are no longer present or barely present. To me, what's interesting is that most yoga therapists don't do this that I've met. I'm sure some do, but the ones I've met, most of them sort of view it more as a like a Band-Aid kind of thing, where you give someone like a counter to what's happening to them. And the problem with that is that people tend to either their life gets harder, they have more external stressors, they age and have more like body stressors. So it's really important to, when you work with someone, if they're willing to go for like the more, what I would call like the more curative aspect. And that usually involves moving down through the koshas a little more. So we usually end up at more like meditation type techniques that often combined with other things too, but that start to shift the actual sort of, in a scientific way, like the structure of the brain, right? So it's having different reactions. So that's what's most interesting to me personally as a yoga therapist. Lots of yoga teachers can help people with anxiety, you know, but they don't have this training to do that. So as you go through the course, maybe just keep that in mind. You know, what am I doing here? Am I giving someone something that's going to work for a few hours, or am I giving someone something that's going to work for a few weeks, or am I giving, you know what I mean? Am I on a path with someone where they'll get out of their issue? So there's lots of things that can stop. I'm not saying it's never indicated, but there's lots of things that can stop someone's ability to do these sort of countering sort of practices. There are lots of situations we get in where practicing our anti-anxiety move, right, is difficult. So ideally, we'd be able to practice preventatively, you know, more. So I think that's where yoga therapy actually kind of shines, and it's very interesting. There are lots of systems techniques that, for instance, with anxiety, that would make someone less anxious at real time. And we're good at that too, but I think looking at a little longer term is where sort of our juiciness is as yoga therapists.